Do you experience a deep, unpleasant sensation in the groin when you have to sit, stand, or stroll for an extended period of time? Or do you feel like your muscles get tired or stiff easily? Does everyone around you look at you with wide eyes when you have to sit down cross-legged with ease? Or do you regularly experience a clicking sound in your hip during certain movements? If you recognize yourself in any of these statements, then you might be having hip dysplasia. Hi everyone, and welcome back to the European Hip Center, the channel where we break down everything you need to know about hip pain, hip conditions, and recovery. In our Hip 101 series, we explain hip conditions so you understand what's happening. Today we're going to talk about hip dysplasia. Hip dysplasia is a congenital condition in which the hip socket is underdeveloped or too shallow, resulting in the femoral head not being sufficiently covered. This leads to instability and increased stress on a joint. Therefore, the hip must compensate constantly. Muscles overwork, the labrum absorbs excessive stress, and the cartilage experiences focal overload. Over time, this can lead to labral tears, cartilage damage, and early osteoarthritis. Although it is often discovered in infancy, symptoms can also develop in adolescence or early adulthood. Worldwide, approximately 1 in 1,000 people has hip dysplasia. It is more common in women, and we also know that there is a genetic component to hip dysplasia. So if someone in your family has hip dysplasia, there's a higher risk that you might have it too. Hip dysplasia is frequently overlooked for several reasons. Firstly, it can be subtle. Hip dysplasia has different degrees regarding the severity of the coverage deficit. Borderline dysplasia may not look dramatic on standard imaging, but can lead to the typical symptoms. Secondly, some symptoms overlap with impingement and labral tears. For example, groin pain after sitting for some period of time. And thirdly, many patients are active and flexible, which masks instability. We often see this in young female athletes, dancers, hypermobile individuals, and runners with persistent groin fatigue. They have good flexibility and their hips move smoothly, but they lack structural stability. And that stability protects the cartilage. Dysplasia pain is not sharp like impingement pain, but rather a deep fatigue, a sense of giving way, and the inability to sustain activity. Why? Because muscles must compensate for the missing structural stability. The gluteal complex works constantly, the labrum becomes overloaded, the joint capsule stretches, and over time, cartilage begins to deteriorate. Pain from hip dysplasia is often located in the groin when walking, exercising with impact, strolling, sitting, or standing for long periods of time. Other common symptoms include the feeling of instability after standing or walking for long periods, and the greater mobility. Some patients may experience clicking or popping in the hip when bending or twisting. Dysplasia itself does not cause pain. Pain only occurs with underlying damage, such as a labral tear or inflammation of the joint capsule. These structures transmit pain signals when they're inflamed or damaged, for example, after sudden movement or overuse. Diagnosis typically involves clinical examination, X-rays, and an MRI scan when labral damage is suspected. During clinical examination, we usually observe increased mobility and can potentially provoke the recognizable pain symptoms. X-ray show less coverage of the femoral head and possible wear of the joint. Untreated dysplasia increases the risk of early onset osteoarthritis by 4 to 6 times. This is because the pressure in the dysplastic hip joint is not evenly distributed, leading to focal overload of the cartilage. Treatment depends on the age and the severity of the dysplasia. Whenever possible, we always opt for a conservative approach, focusing primarily on exercise therapy. Exercise therapy strengthens the muscles around the hip, providing more stability and thus relieves the hip joint. In addition, it is also important to modify activities to relieve the load on the hip. Many patients stabilize successfully for years, but rehabilitation cannot change structural coverage. If instability remains severe, compensation fails, and this is when surgical correction becomes strategic. The corrective surgery for significant dysplasia is called periacetabular osteotomy, also known as PAO. This procedure reorients the socket to improve femoral head coverage. It restores stability, redistributes cartilage load, and protects the joint long-term. But timing is critical because a PAO works best when cartilage is still preserved. Once advanced osteoarthritis develops, hip replacement becomes the better option. And this is why early recognition matters so much. Hip dysplasia is not weakness, it is anatomy. But anatomy influences biomechanics, and biomechanics influences cartilage survival. The earlier instability is recognized, the more options remain available. Stabilize with rehab, correct with a PAO, preserve long-term joint health. Missing dysplasia shortens timelines, recognizing it protects for decades. Thanks for watching. If you have more questions or like to know more about your hips, you can follow us here on YouTube for more, or check out our website at www.europeanhipcenter.com. We also have an Instagram page, so definitely check us out there too. See you next time.